Hi class. This week we're going to focus on food accessibility. In my current research, I focus on geographic aspects of food accessibility through GIS. So in this lecture, we're going to focus on geographic approaches to evaluating food accessibility. Food security can be defined in a couple ways. The first is the UN Food and Agriculture Organization, which states that food security exists when all people, at all times, have physical and economic access to sufficient, safe, and nutritious food to meet their dietary needs and food preferences for an active and healthy lifestyle. According to the USDA, food security is known as the ready availability of nutritionally adequate and safe foods, an assured ability to acquire acceptable foods in socially acceptable ways, that is, without resorting to emergency food supplies, scavenging, stealing, or other coping strategies. So I know that this class isn't focused on geography completely, but I wanted to give a little bit of background considering the different topics that we'll cover. So the first is the Tobler's first law in geography, which states that everything is related to everything else, but near things are more related than distant things. So this concept is basically just saying that in time and space, things that are closer together are usually related more to one another. In order to conceptualize the world around us, we use geographic information systems as a tool. So geographic information systems is a way that we can see, analyze, and understand spatial patterns and relationships. Some examples of GIS in action in our day-to-day lives includes right now with the COVID-19 crisis, considering the dashboards that we've had coming out with that. Then we can also look at food desert analysis or hurricane evacuation preparedness, along with other urban and regional applications. So you may be wondering, what is food accessibility? Well, food accessibility or food access refers to an individual's ability to obtain fresh and affordable foods. The U.S. Department of Agriculture, in conjunction with the CDC, had developed several tools to enhance our understanding of food access. Food deserts are known by the United States Department of Agriculture as census tracts which lack adequate access to fresh foods. Studies have found that most are found in low-income or traditionally racial ethnic minority neighborhoods. And additionally, for many grocers, the lack of profitability in low-income areas may serve as a deterrent. As a quick overview, the picture on the left shows census tracts which are considered food deserts in the Tampa Bay region surrounding University of South Florida. Census tracts are a unit of measurement that the government uses to subdivide geographic regions. A census tract is often thought of as representing a neighborhood. In geographic analysis, census tracts are commonly used. As a geographer, some questions that we have to ask ourselves are, is there anything wrong with this model of approximating food? And how can we incorporate socioeconomic or demographic information with geographic data to identify areas of food insecurity? Additionally, what types of people are most at risk for food insecurity by region? Perhaps the biggest indicator of food accessibility is our proximity to healthy and less healthy food retailers. Healthy food retailers are made up of supermarkets, larger grocery stores, supercenters, and produce stores, while less healthy food is represented by fast food restaurants, small grocery stores, and convenience stores. This map shows the distribution of healthy and less healthy food stores in the Tampa Bay region. As a geographer, it is our job to take information such as this and make them into maps that can be easily interpreted by policymakers to find where people are food insecure. We can do this by combining this information with other information as discussed earlier. We may be interested in areas that have an excess of unhealthy food options. These areas are known as food swamps, or regions that have more unhealthy options than healthy options. Increasing research may suggest that excess unhealthy options are most frequent in communities of color. So, how does this affect community health? Research shows that people who live in food swamps have a greater likelihood of experiencing the following complications, including obesity, cardiovascular disease, depression, and diabetes. So, what factors might increase the risk of these complications? What if somebody has limited transportation or income? In this module, we'll focus on how geographers use GIS to better understand food insecurity. To do this, we'll first introduce you to what GIS is.